So I had a client ask about, can SE help me with addictions? Yes. And why is it? So addictions, and I don't care if it's alcohol, drugs, gambling, sex, and even a favorite one, this is going to hit people really hard, but Netflix binging, right? That can be an addiction. Any of those type of addictions, what we're trying to do is get out of the body and out of the head and away from our feelings. So what we do with addictions in SE is we gently bring back the sensations back into the body, just noticing and being real gentle about it. What is it that you don't want to feel, or what is it that you do want to feel? And work with resourcing literally in the body. And then also too, and this is important, and this is where SE becomes really critical, is the relational piece. So most of the times when addictions strike, it's because we've divorced someone, we've lost someone, or something has fallen apart in relationships, and the feelings become so overwhelming, and then we don't pay attention to them. And then we start using, and it can be anything, there's no shame or blame in it, and then we lose sensations in our body. So we kind of address it in a three-part way, really. What are the emotions we're trying to avoid? Where are they located in the body? And then what are you thinking about it, right? And of course, with addictions such as alcohol and drugs, SE works nicely, along with the support systems such as recovery, AA, whatever the mechanism is, we work with that. At first, it can be scary. It's scary sometimes to feel sensations in our body and to feel our emotions, but it's necessary. It's probably the most greatest work you'll ever do as it relates to addictions. Because what is it? Because in your vulnerability is how you're going to find your way back out of it. And that's the truest thing ever. And is it something that that's easy? No, it isn't. If you have an addiction with food, or such as an eating disorder, which some people can classify as an addiction, wanting to eat or not eat, those are sensations that you can actually feel in the body, and trying to mask not feeling emotions or to feel emotions. And it can be scary. It's one of the scariest things you do. But that fear, this is interesting, that fear serves as a mechanism. And we go back to the original mechanism of the first fear, very gently, feel it, and then see what happens next in the body. And you'd be really kind of surprised. So addictions are amazing work to do with somatic experiencing. I've seen very, very good results, and I've worked with a lot of folks in the recovery community. Very, very phenomenal work, easy and gentle.